there's a really intimate relationship between the neck and the jaw. And with forward head posture, every inch we're forward from that ideal position puts an additional 10 pounds of strain and pressure on our neck and our cervical spine. TMJ work is more about, like, what the patient can do for themselves is more about not doing than it is about doing. Too much caffeine can definitely just sort of dehydrate the muscles and just keep us on this constant high. So when we're like that and our bodies are in that mode, we're more inclined to anxiety. And when we're more inclined to anxiety, we're more inclined to clench and grind our teeth.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 329. I am your host, Andrew Johnston, and this week I am joined by Stephanie Botts as she co-hosts with me, and we have a great discussion with Dr. Priya Mistry regarding the TMJ and all of those really annoying problems that can come with it sometimes. And I cannot stress enough how important it is to go over and check out her YouTube channel, please. She has some exercises that you can show your patients so that they can get some relief before they go see Dr. Mistry or another specialist that does similar things. I tend to clench my jaw quite a bit. After doing just a few minutes of the exercises that she had in one of her videos, it really calmed down, those muscles right there, those masseter muscles. I'm sure that's not the actual right muscle. I'm sure Claire Jong would love to have another test with me on there, making a fool of myself and not getting the answer right. But whatever those muscles are, and it also extended all the way down my neck. I'm so sorry that I forgot my dental anatomy. Please don't crucify me. I don't want to get all of your guys' letters and emails. I'm good. I promise. But those exercises really did help me feel relief. And so, firsthand testimonial, I love what she's doing. She has a great presence on screen. And I think that you're going to enjoy not only this episode, but also the other things that she has. Next week is our roundtable. And we had Sarah Lawrence, Tamika Lee, and Bethany Montoya on, and myself. I was there too. And we talked about social media and where it has come and kind of gone in our lives, which is so funny to think about because, a lot of us, we were kind of there when social media became a thing, and we're still kind of here. But what kind of role has that played? What kind of importance is that currently playing in our lives? So definitely a different type of podcast, but I really loved it. And I really appreciated them for all being on and getting actually a little bit vulnerable on it. So that was really nice. The day that we recorded that one, though, we also recorded two other episodes that you'll be hearing in the future. We brought back on two of the favorites. One, it's been a bit since we've had Andre Jourdan on, but he used to do some TIPisodes for us. And then he also was one of our early, I think episode 26, I think is what it was. But he was one of our early people to be on. He took a chance on us, and it worked out, really well for us, and we appreciate him doing that. But he came back on to talk about kind of a simple way to get all of the crew, is what he likes to call everyone. He doesn't like using the word team. And getting the crew to work together to classify perio and to help the patients see the value in the treatment that we do. So he has a whole system in place to really help that. And we also brought back Dr. Sam Shamardi to talk about the role finances play in our lives, but not only our lives as clinicians, but also our personal lives. It was a super productive day that we did all these recordings, and I can't wait for you all to hear because we had Tamika Lee. She was on as my co-host for the day, and she's brought some really great perspective, some really good questions. So I really appreciate that. And these are these are coming out in the future. So make sure you hit that subscribe button now so you don't have to try and remember to download them when they do release. So it'll just go straight into your podcatcher, which is a fancy term for your podcast app. Yay. You learned some industry insight. It's also been a while since I've asked, so please make sure that you go back and rate and review us on your said podcatchers. It really helps us to spread the wonderful message that these people have taken the time out of their lives to share with us. One last thing that I do want to talk about, someone called me out the other day on it. Actually, several of you have called me out on this, Andrew, why do you talk so fast on your intros compared to the interviews? And there's two reasons for it. One reason that you guys aren't really going to care about, but it's the editing process. I do have our editors kind of clip my words a little bit closer together just because I really want to get this message part done, out of the way, and get you to the good stuff. And that's really, that's the second really big reason is because, people have so many good things to say. And I've been on your end of the podcast listening, and I'm saying, just get out of my way and give me the meat, give me the good stuff. And so that's really what I'm trying to do. I really hope that you guys are all okay with it. Let me know if you want me to slow down. I'll be more than happy to do that too. You just got to give me a heads up. So email me, Andrew at A Tale of Two Hygienist, and I will consider that. So that is all from me for this week. Enjoy this episode with Dr. Priya Mistry. Welcome back, everyone, to the interview portion of this podcast. We are joined today by Dr. Priya Mistry. Thank you so much. This is early for you on the West Coast and us me on the East Coast. So thank you for making time to do this.
Oh, of course. I'm so excited to be here. Thank you for having me.
Doctor, I think to get this thing started, we would like to maybe start in with just your background. Like where are you coming from? Where you went to dental school? And what does your practice look like today?
Sure. So I grew up in the Pacific Northwest, and I just love it here. So my practice currently is here. I'm in Vancouver, Washington. I went to dental school at University of the Pacific, which is in San Francisco. It's a 3-year dental school, and it's a very, very good school. So I'm very proud to have graduated from there. And so after I went to dental school, I practiced in San Francisco for 3 or 4 years, and then I moved back to the Pacific Northwest. Met my husband, who's from Southern California. So we tried out Orange County for about 3 years, and it's just really not for me. I'm very Pacific Northwest, and luckily my husband loves it here. So we moved back here, and that was 2016. So we've been here ever since, and we're lacking on the vitamin D, but we're working on that.
They got supplements for that.
Yeah, right. They have supplements for that. So we moved here, and then I bought my TMJD only practice it was just last year, 2021. And that's what I've been doing ever since. So yeah, that's a little bit about me, and I love what I do.
Well, it's interesting. I think for the listeners, you guys all know, you followed me on my journey of, I traveled cross country, doctor. I went from Vancouver, Washington, right where you guys are
love that.
all the way down here to Tampa. And we documented a little bit on the podcast, and it was really fun. But one of the things that you just mentioned, though, the lacking vitamin D, while it's kind of a joke, it's really not. And every time that we would have our patients, I was there for 5 or so years, every single medical dental history had vitamin D as a supplement. I swear, as all of our patients were taking it. And it's something that they definitely need. So I'm glad that you brought that up. So first of all, can we identify the correct verbiage?
Yes,
because
please.
TMJ, TMJD, or TMD, that TMD is what I learned in school, but TMJD sounds more inclusive. What should we be saying? Which of those terms?
Right. Well, definitely not TMJ, because all that means is temporomandibular joint. So to say I have TMJ is like saying I have knee or I have elbow. So a lot of patients will come in and say, well, I have TMJ, or I've had TMJ for so long, and I'm not obnoxious, so I don't correct them.
But you laugh a little bit on the inside, right?
Yeah, I'm just kind of I just cringe a little. I can't help it. But the correct terminology would be to say I have TMJD or I have TMD. Both of them can kind of encompass the same thing. So TMJD is temporomandibular joint disorder, and TMD is temporomandibular disorder or dysfunction. And both are right, and they can encompass kind of everything, whether it's jaw joint noises or more like the headaches, jaw pain, neck pain, etc.
Okay.
I feel like a lot of doctors, so, when I was seeing patients every day that would come in, I have this pain right here. I would say, doctor, this is my patient, Andrew, he's been having, TMD or joint pain on the left side. There's, clicking, whatever for 1,000 years. And the doctors would just kind of okay, that's cool. And they would doctor, is there anything we can do about it? They're well, not really. Mm-hmm. So how did you kind of latch onto this, I feel like it's a little bit more niche area that is definitely needed, but it feels like a lot of doctors don't want to go into that area. So how did you make that leap? Or why did you make that leap?
Yeah. Well, first off, I was practicing for 11 years before I met my mentor. I met him in 2018. And he's the guy that he was the TMJD guy in the area. So he mentored me until he retired last year. So prior to 2018, I would do the exact same things that you're saying. Like I would say, oh yeah, well, some people have popping and clicking. Have fun with that kind of thing,
Yeah,
right?
Call me if it gets worse.
And I think
that's what I hear all the time.
Yep.
Yeah, call me if it gets worse, but then what, right? And so what we were sort of taught to do in dental school, so we were taught the anatomy of the joint, and beyond that, not a whole lot. And so some terminology like disc displacement with reduction, without reduction, but what do you do about it, right? And so, I really came across that a lot. And to be fair, like I didn't really know. So I think that's why you get that answer so much, is because we don't have the knowledge of how to treat it. Mm-hmm. And so we moved here to Vancouver, Washington in 2016, and I had a baby in 2016, and then I had a baby in 2018. So I didn't know, I was at home all the time. So I wanted to be home with my babies. I didn't know the dental community here. And so in 2018, on like a random whim, and I'm so grateful it happened, I walked into this jewelry store to fix a necklace, and I started chatting with the owner, and her husband is the main TMJD guy in the area. Oh. So it was totally random, totally organic. And so luckily we're both talkative, outgoing individuals. And so we started talking, and she started telling me about what her husband does. So I left my necklace there, and I walked out of the store, and I knew I was going to come back in like an hour to pick it back up. And I called my husband, who's also a general dentist. And I said, hey, I just walked into the store, and the owner's husband is Dr. Arthur Parker. And he's like, Dr. Parker? He goes, that's the TMJ guy in the area. And I was like, yeah, I just wonder how he has a practice where he only treats TMJ issues. Yeah. Because that's really unheard of. Like you hear of like sleep and TMD, and you hear of just sleep, but you don't really hear of just TMD. So I thought, And I said, well, I've always wondered how to help patients more. And I said, do you think I should go back in there and ask for his contact information so I can maybe just shadow him, meet him, whatever he's open to? And he's like, yeah, definitely go do it. And so that's kind of where things took off. So I ended up getting his contact information. He was really sweet. Like he responded right away. He said, yeah, come in, like, let's meet. And maybe we could set up some observation if you think this is something you're interested in. So, from day one, we just hit it off. I mean, he's just such a wonderful person. And he was so easy to talk to and work with. And I'm very inquisitive, and I was always poking him with questions. And so it just sort of took off from there. We just established this really great professional relationship. And from day one, I was just floored. Like I left there thinking, did he plan for all those patients to come in? Because people were coming in saying, he saved my life. Are you buying the practice? Will you please take over? People need help. Who are they going to go to when he retires? And I just thought, and he would do this whole examination where he would check their posture. He would check their leg length. He would, he was doing all of these things that we weren't taught to do in dental school. And I was so confused. I just thought, what is happening here? And then, so I would see the examinations, and then I would see patients that he had been treating for like 2 months. And they would come in and they would say, my headaches are gone. I haven't had a headache since before I saw you. And I was like, what is he doing? And so, of course, I was interested. I was like, I want to know what you're doing. And he would help patients whose jaws were locked closed, where they could barely open 1 or 2 finger widths, to where they had a great range of motion, no pain anymore. And I was just so fascinated. And I never loved general dentistry. So this was like sort of my way to be like, how can I transition? How can I have a career that I'm passionate about and use my dental knowledge still? Right. And so I jumped on that opportunity. I'm not going to lie. My son was like 2 months old. And I told my husband, I was like, I want to be mentored by him. He's looking for someone to buy his practice. Like, do you think we can make this work? And my husband is the most wonderful, most supportive. He's just wonderful. So anyway, long story long, you asked a quick question. I gave you an essay answer. But so that's sort of where things ended up.
So you say you're talkative, huh? Okay. I'm just
not
kidding.
Not at all.
Would you say your practice? I just have a question, because your practice is so unique, and that you only specialize in TMJD. Would you say that your practice is mainly like referral based, or do you have patients like coming directly to you also?
Great question. Yeah, great question. Dr. Parker did this work for 40 years in this area, and he grew quite the referral pool.
Okay.
But what's interesting is that there's another dentist doing this work in this area as well. And Dr. Parker's base is sort of the naturopaths, chiropractors, acupuncturists, the holistic people, holistically minded people, I would say. And then the other dentist who's doing the work in this area had a lot of the dentists. We still have a lot of dentists too in our referral pool, but it's sort of interesting because ours is Dr. Parker was kind of the OG holistic guy in this area, and we're really careful not to call ourselves specialists. Sorry, I'm just going to throw that in there.
Okay.
Yeah. We do say we're general dentists that treat TMJ. Yeah.
Oh, fantastic. So so our audience is listening to this and they're going to be thinking, okay, where do we start in understanding TMJD and what are the key symptoms of this?
Yeah. So the key symptoms are usually headaches, jaw pain, clicking and popping noises, or the jaw actually being closed. Not locked open, where it's kind of stuck open, which can happen after a long dental appointment, but closed, where it can barely open 1 to 2 finger widths, and there's a lot of pain associated with that.
So I like how you mentioned just a little bit ago about posture, how your mentor assessed posture. And me being in ergonomics, I'm all about posture. And I saw your video on forward head posture. And so I'd really like to just pick your brain as far as forward head posture as it relates to TMJD. And also, because I'm working with dental clinicians, a lot of us are in forward head posture because that's what we do. And I'm just curious if there's a higher incidence of TMJD among dental practitioners because of that forward head posture.
Oh, that's a good question. I wouldn't say I see a ton of dental practitioners per se, but I do see a lot of like hairstylists. I mean, they're kind of stuck in that awkward posture all day. And there are some hygienists that I see, but I think hygienists might even be stuck in that posture a little bit more than us dentists. Because you're doing kind of the same thing all day, whereas dentists, if we make a denture, we're not stuck in that posture, right? So forward head posture, there's a really intimate relationship between the neck and the jaw.
Okay.
And with forward head posture, every inch that you're forward of the ideal posture, which is like ears in line with our shoulders. And we're all correcting our posture as I'm speaking, me included, right? We're all trying to be in the ideal posture.
I'm testing out your theories, doctor.
Yeah, right. I see you, Andrew. I see you. So every inch we're forward from that ideal position puts an additional 10 pounds of strain and pressure on our neck and our cervical spine. So most of us, if we're in front of the computer, if we're hunched over a patient, if we're hairdressers, whatever it may be, we're probably forward about 2 inches from that.
At least, right?
And that's enormous, at least. So it can have a really negative impact on the neck, and then that can feed up and affect the jaw. But I feel like with TMJD, there's a number of factors that go along with it. So it's like if you have an imbalanced bite, and you have the forward head posture, and you've had 2 really bad whiplashes, all of that adds up and you end up with a TMJ problem. So it's not just the forward head posture alone, usually. There's something else too. So it's every patient that walks in, it's like a mystery. You're trying to solve that mystery and put together the puzzle pieces to see why they ended up where they are.
That's really interesting.
I feel like we've all had some sort of other trauma though, right? I mean, I don't want to say everyone's been in a car crash, but like Pacific Northwest, a lot of us have been, accidentally bumped a couple of times.
Right.
So it's probably not all that uncommon to have a secondary contributing factor.
Right. It's not. A lot of my patients come in with kind of many factors.
So as a hygienist, like if I have a patient that comes in and that's complaining about TMJ, like how would I start to either assess them myself, or should I just be like, you know what, you need to go see a doctor that specializes in TMD? Like where's the line, I guess?
Where's the line? Yeah. I mean, I think you can do 2 really easy, quick things right away to assess them. And one is to check their range of motion.
Okay.
And so there's this great range of motion scale that's made by like Great Lakes or something. And it, not the student loan company, but Great Lakes Orthodontics. So you can check their range of motion on opening and right and left. You don't even have to check protrusive, because by the time you check opening and right and left, you've pretty much got a clear idea if they have a healthy range of motion or not.
So what are we using as a device to record to measure? Because I can't imagine, I've never measured someone's opening before, and left and right from where? From the midline?
Yeah, from the midline.
Maxillary midline?
Yeah, so you have them bite down. So first, it looks like it's just like a little thing made out of paper, and it has like a millimeter scale. So once you get it, there's a little notch that you can place on the bottom front teeth on the incisal edge of like 24 or 25, and then you just ask them to open. So you're measuring from incisal edge to incisal edge. So of course you want to take an anterior open bite or a deep bite into consideration and add or subtract accordingly to really get a good opening range of motion measurement. So then you measure them open, and then you turn it on its side, and it has a side-by-side millimeter scale. So I'm sorry, it's hard to describe. It's much easier if you can just see it.
I go watch your videos, and then you guys will be able to see it.
I know some of my videos, yeah. And then you measure from midline. So you have, or where they line up. So I usually just say bite down in the back, and then I mark or I just sort of visually see where their maxillary midline is, and then I have them go right and left and measure those. And so a normal range of opening is 45 to 50 millimeters.
Okay.
And then our right and left is 10 to 12 millimeters. So already you have an idea of what's going on.
And we could easily do that as a hygienist, right? Just like
easily.
Yeah. Okay.
I mean, it literally takes 15 seconds. You say open, and then, bite down in the back, open a little, and slide it as much to the right as you can go and as much to the left as you can go. And then you you jot down those measurements. So that's one thing. So if they have a really restricted range of motion, like they're opening to 20 millimeters, you already know something's going on. And typically they're in pain too. And so that's one thing you can do, is check their range of motion. The second thing you can do is do a muscle palpation exam. And that can be really quick too. It doesn't have to be this big drawn out thing. And then I did make a video on how to do a muscle palpation exam. So it's on my YouTube channel.
Awesome.
And it's checking the temporalis, the masseter, the posterior digastrix, anterior digastrix. You're checking a lot, the temporalis tendon insertion, the lateral pterygoid, if you believe you can palpate that or not. I don't really want to get into that. That's a whole other debate. So doing that will give you a really good idea, because you should be able to put 3 to 5 pounds of pressure on all these muscles without it hurting. It should just feel like I'm pushing on you. And a lot of these patients, they're like through the roof, or they're like, that hurts. That's not just pushing. So you get a good idea already just from that.
And then as a hygienist, if I'm doing those things, then clearly someone's got, limited range of motion or pain. That's when I would say, okay, well, you probably need to see someone for treatment about this.
Yeah, definitely.
That's so fascinating to me. None of this is anything I've ever done in my entire life.
Right.
Ever.
Right.
Doctor, they're in pain. That's it. That's what we do as hygienists.
Right.
So it's nice to know that we can actually take a little bit more control of the appointment and really kind of help our patients like in an additional factor. Because I think we all want to be healers, right? We always want to be the person that's going to be the problem solver, right? And having an answer for somebody, even if we can't solve it ourselves, is a solution. People love that. So it's also a practice builder if you can answer questions. I'm all about practice building, doctor. I want our patients to come back to us, and we got to be nice and all that.
I love that.
Okay. So there were some exercises that you have some videos on, and obviously this is an audio podcast, so you'll have to just go watch the videos to see it. But what type of exercises, like let's say me as a hygienist, I'm having some issues. What are some of the ones that you recommend that I can do at home?
Yeah. So my YouTube channel has a playlist called TMJ Exercises / muscle releases. So that one's really great because it has a ton of videos on there. And the muscle releases are actually more beneficial than the one exercise video that I have. So my mentor always said TMJ work is more about, like, what the patient can do for themselves is more about not doing than it is about doing. So not doing, like avoiding really tough to chew foods or really hard foods, not resting your hand or your fist against your jaw and pushing it laterally. A lot of us do that when we're kind of, at work, just resting on the desk.
I'm asleep, doctor. I do that when I sleep.
Or asleep. Yeah, that's not great either. So there are more do nots than there are do's. Having said that, the do's are in that YouTube playlist. There's a lot of like sort of massages and muscle releases that you can do for your temporalis muscle, your masseter, again, that lateral pterygoid, even the temporalis tendon, and the SCM, this big neck muscle right here. Sorry, I know it's an audio podcast. I keep pointing to myself. So there's a big neck muscle that's really usually involved in all of this as well. So doing those releases can be incredibly beneficial. And I've heard from people around the world that those have helped them. They're like, oh my gosh, I do this and I suddenly have an increased range of motion, or I do this and my neck pain goes away for a little while. I even had one patient say that they did my muscle releases religiously for, I think, like over a month, and their jaw unlocked. Now, that's almost unheard of. I can't guarantee anything like that, but they can be incredibly beneficial. And then there's one exercise on there as well. So I would definitely say check that out, or encourage your patients to check that out as hygienists when you're, offering them some solutions, and then also knowing the local TMJ person and how they treat is really important. So I would say get to know that person in your area, or encourage your doctor to.
Would you say your practice model, how you are focusing exclusively on TMJD, would you say that is, to me, it doesn't seem like that's very common, but would you say that that more people are going into that? Because I'm in Denver, and I'm just curious, if there's even anyone here that does what you do that I could refer patients to.
I would say that a lot of dentists that are doing sleep, like dental sleep medicine, are also trying to pursue the TMJ route because there's such a correlation there. Okay. There's such a connection. A lot of my patients, I would venture to say, have some sort of sleep disordered breathing. Okay. So, but I don't think there's a lot of people that treat just TMJD. I wish there were. And the way we do it, is a little bit unique too, because we make custom made mouthpieces, orthotics, that put the muscles in their most relaxed position, that decompress the joints, but we follow up and we provide therapy. So we do a very subtle head and neck massage. We go in the mouth, we release muscles, and we do a very subtle but effective jaw manipulation to help the discs that might be out of alignment get back in alignment, and to help patients unlock who are locked closed. Okay. So I don't see a lot of dentists doing jaw manipulation. I don't see a lot of dentists doing myofascial release. Yeah. And so that we're a little bit different that way.
And there's not like an organization or anything that you guys could belong to as a group, to like a referral network nationwide. You guys don't have anything like that?
Yeah, no, not doing things exactly this way. So we also use the neuromuscular dentistry concept, where all the software is used to measure the most optimal position for the jaw. And there is a network of dentists that use that. And that's ICMO. So international. Oh gosh, I don't remember.
We'll look it up and put it in the show.
Yeah. Okay, I'm sorry. Yeah. So they can make orthotics in a similar way, but I don't know if many of them do the myofascial release, the jaw manipulation, and then following through with the patients. I mean, I have my patients in treatments for 4 to 6 months to make sure that they're getting the benefit of what we're doing.
And would you say with really complex cases, because at least my understanding of this is pretty limited, but if we have patients that have chronic TMJ issues, it's almost like deal with it or get surgery. But surgery isn't necessarily like the best answer from what I've heard, because it's pretty complicated and it's not always predictable. Is that correct?
Yeah. That's what I see a lot. So we, for example, we had a patient who came to see us, and her jaw had been locked closed for 2 years after she had a really bad car accident. That's when everything just sort of spiraled for her. And so she went to a couple of oral surgeons. Obviously, she went to her dentist first, a couple of oral surgeons, and everyone just sort of told her the same thing. And one oral surgeon even went so far as to say, you're going to be like this the rest of your life, so get used to just blending your food. And she could barely open. I'm talking like maybe 15 to 18 millimeters. So she came to see us, and Dr. Parker, said, we can help you. And she was in a lot of pain too. I mean, like headaches daily, jaw pain. She's young. She was 26.
Oh my gosh.
When we started treatment with her. And so she just couldn't fathom the rest of her life being like that. And so now we have her at a healthy range of motion, really limited pain. She'll kind of get a random flare up here and there if she's really stressed and she's clenching heavily. But, she's told us this. This is not me tooting my own horn, but she said, you guys changed my life. You turned it around. And so that's really, it's gratifying and it's amazing that we can do that. So, it's unfortunate that she heard from all these professionals that there wasn't anything else to do. And I mean, the oral surgeons didn't even want to operate. They were just like, we can't help you. So that's what I'm seeing.
Well, it's just nice to know that there's options for people, especially non-surgically, that actually work.
Yeah. There's options. And you know, to be fair, it doesn't always work. I have like a 90% success rate with the jaws that are locked closed. There are some situations where the disc is torn or just so far degenerated that my methods don't work.
So switching gears a little bit, Doctor, I saw one of your videos, which again, you have the most amazing content out there. It's not boring. It's all varied and there's different. Anyways, okay. So here's what I want to talk to you about, Doctor. Everyone who's listened to this podcast for any significant amount of time knows that I have one Rockstar energy drink every day. Not Red Bull, not Monster. Let's not put that garbage into us. But there's also many people who, like, when we go to our break rooms, how many have had like 3 or 4 cups of Keurig, and how many people have like their big old tall things? Like, caffeine is a drug of choice for dental professionals, right? So you had a video about that, and I kind of wanted to maybe just kind of give like a little bit of a teaser or just a quick explanation about what does ingesting too much caffeine do to us, and what effect does that have on TMJ disorders?
Yeah, so too much caffeine can definitely just sort of dehydrate the muscles and just keep us on this constant like high. So when we're like that and our bodies are in that mode, we're more inclined to anxiety. And when we're more inclined to anxiety, we're more inclined to clench and grind our teeth. And so caffeine is fine. I mean, I'm drinking coffee as we're speaking, right? And so, but I would definitely limit it to like 1, maybe 2 caffeine drinks per day. So 2 cups of coffee or less is what I would definitely recommend. So you're one Rockstar. If it's one Rockstar, that's okay.
Oh, Doctor, let's not go there. It's still not okay. But thank you for trying to make me feel better about my habit that I'm not supposed to.
I'm just like thinking of how big the Rockstar can is. I'm like, I wonder how.
Right.
Yeah, I was like, so a giant one, Doctor. That's what I'm hearing. Just one. Though.
Yeah,
it's a ginormous one.
It's still one. Check the caffeine content and see if that's comparable to 1 to 2 normal cups of coffee. But I wouldn't have more than that. So those of us that are having 3, 4, 5, 6 cups of coffee, and I know people that do that. It's just not good for our systems on so many levels. And if you're having that much coffee, you're probably also not having enough water. And hydrating those muscles is important too.
That's absolutely true.
Yeah.
I find myself like craving water throughout the day. I think it's because I'm so dehydrated.
And then you're
sometimes.
like, no, I'll just have another Rockstar.
So it's like, there's water in this, right? That's like, I'm dehydrating through this. Exactly. So, Doctor, I mentioned before, I really love the videos that you do.
Thank you.
And I know that you are kind of moving into like TikTok and things like that. By the way, I saw the TikTok video. It was you and your husband, and it was like answering the 14 questions for couples. Adorable, by the way. And it was also very funny. Like, no, him, no, me. Anyways.
Thank you.
But if people wanted to find you, people want to check out your content, like where would they go find you?
Yeah, so definitely YouTube. I think my biggest presence is probably there, and I started at the earliest. And then Instagram and TikTok. I'm new to TikTok, but I'm trying to grow. So Instagram and TikTok, my handles, I guess, are at @the_TMJ_doc. But definitely check those out. TikTok is kind of neat if you're short on time because they're quick. They're way faster than my YouTube videos.
Yeah, they're like 5 seconds long.
Definitely don't sleep on the YouTube videos though, because it's just like I mentioned before, it's so varied and so amazing. Make sure you guys do hit the subscribe button to that YouTube channel, because that way it'll just automatically pop up right on your feed. So thank you, Doctor, so much for being here. We appreciate you so much. Hopefully in the future we can do some more episodes.
I'd love to. Just tell me when.
Awesome. Thanks. Have a good day.
Doctor.
Yes, you too.